It's time to talk with our professionals from Maui Health. And, of course, we do it every Thursday morning right around now. Mahalo to you. I want to say good morning to Dr. Amanda Marn, cardiologist, Hawaii Heart Associates. Good morning, doctor.
Good morning. How are you today?
Well, good. Thank you for calling us this morning. Now, Dr. Amanda, what is AED and how do I use an AED, and do I have to be certified?
Oh, those are great questions. So an AED is an automated external defibrillator, and it's used for people who are suffering a cardiac arrest. It is a medical device that's able to both diagnose a life-threatening cardiac arrhythmia. An arrhythmia just means an abnormal heart rhythm. And the rhythms that it's looking for are things such as like ventricular tachycardia or ventricular fibrillation. And if it recognizes those rhythms, it can actually deliver an electrical shock and treat that abnormal heart rhythm. To use an AED, first, I want to bring up that it's important that you use it in conjunction with CPR. So if you see someone who's collapsed, you're going to start CPR and have someone get an AED. And the AED, again, does not replace CPR. And I know my colleague, Dr. Kimball Poon, he talked about how to do CPR just a couple of weeks ago with you.
Yeah.
And so with a modern AED, you don't have to be certified, and they're actually very easy to use. So once you turn them on, it'll actually tell you audibly what to do. And it also has pictures in the device to kind of guide you through what to do. So again, once it's on, you just place the pad on the chest of the patient and you plug it in. The AED will ask you to temporarily stop CPR so it can analyze the heart rhythm. If it detects one of those abnormal heart rhythms, it will recommend a shock. If it doesn't detect one of those rhythms I talked about earlier, it doesn't recommend shock and would instead just recommend continuing with CPR.
Dr. Marn, it sounds like, is this model an updated model? Was it always like that from the get-go when AEDs were available?
I think kind of a couple things have changed.
Yeah.
So one, I think AEDs are a lot more common where people can find them more easily. So they're in airports, government buildings, and schools. But there was also a change, too, where they're recommending really just compression. So I know in the past there was this confusion about compression and breathing and what's the ratio and all of that. And now we really just focus on compressions and AEDs as being kind of the frontline treatment for patients with cardiac arrest.
So, doctor, say, for instance, I'm in that situation to use an AED. Can an AED hurt someone? And what would I do right after I end up using or shock the patient?
Yeah, so it's a great question. So, in general, an AED cannot hurt someone.
Okay.
It's never going to shock someone who doesn't actually need to be shocked. They're pretty smart at being able to tell what is the abnormal heart rhythm. The one kind of caution and recommendation is that if it does recommend a shock, you're going to have to clear the patient and make sure no one else is touching that patient. And the AED does give you that warning before you deliver the shock. And once a shock is delivered, it's going to recommend that you begin CPR again or the chest compressions.
Wow, interesting. Pretty self-explanatory almost, because, we've watched a lot of movies, doctor, before, and we see how it is, and they say clear, and nobody touches the patient, and so that is reality in using the AED.
It is exactly like that. And if it's okay, I just want to remind everyone that if ever you've started CPR on someone or you're going to use an AED, it's so important to call 911. That's kind of like calling in backup or the cavalry, right? Because you need someone else with more advanced training to come and help you.
Awesome.
And my friend Pamela Foster, she works with the AED Institute, and she's actually traveling to all the high schools in Hawaii to teach 10th graders the simple acronym of CPR when you see someone suffer a cardiac arrest. And so C is for call 911. P is for push on the chest, so that's CPR or chest compressions. And R is respond with AED. So if you can remember those three things, you can save a life. And so it's important, I want everyone to remember that really the most important person is actually the bystander in you. And that if you just remember those simple things, call 911, start chest compressions, use an AED, that you can save a life.
I love that. Call, push respond with an AED. Dr. Amanda Marn,
Exactly.
what a great conversation with you this morning, and thank you for taking the time and answering those questions. We'll talk again, okay, doctor?
All right. Thanks. Have a good day.
You too. Aloha.